Okay. Great. So we'll move on to hip and knee arthritis. You guys probably know a lot about this. I kind of wanted to introduce a couple of new things, and then we'll kind of stop at the end of that for questions. And if you think about questions from the fitness part, we can answer those too later. So hip and knee arthritis kind of.
Okay. I just had the hottest spread.
Oh.
I thought it was mild, Saturn or something.
It was last night. Yeah. Yeah. Every so often you'll get somebody on the news, a 95-year-old, 100-year-old that's still exercising, still walking, and those are really, those people are inspirational to me, and those are really the role models that we should all try to follow. So joint replacement, very common. You know, we have dignitaries, rock stars, athletes that have had them. The good news about joint replacement these days, it doesn't mean your life's over. Tom Watson's actually the oldest player to play second in a major championship in a while, and he has hip replaced the year prior. So it doesn't mean that if you have a joint replacement or if you have arthritis that you have to stop doing what you do. So today we'll talk about a bit about arthritis. We'll talk a little bit about the treatment options without surgery, which should always be used, and then we can talk about a couple of new surgical concepts. So here's an example of an arthritic hip. Okay, you have the femur, the thigh bone here, and then the top of that bone is the ball, and the pelvis is what it articulates with. Okay, and so the hip is a ball and socket joint, and basically you have the ball of the femur, and again the socket of the pelvis. Okay, now what's the leading cause of hip pain in this country? It is osteoarthritis. And basically what is arthritis? It's a wear and tear condition that's degenerative in nature. And what arthritis truly is if we look at this picture right here, you can see here's the femur, the thigh bone, okay? Here's the head or the top of the femur, and here's the pelvis, okay? This pink stuff right here, that pink stuff is called cartilage, okay? Cartilage lines the end of our bones at every joint, even the little finger joint right there, there's cartilage at the end of both of those bones. What arthritis is a deterioration of that cartilage, okay? So why does that happen? It can happen for any number of reasons, okay? It can happen because you have abnormal anatomy. Maybe you had a problem with your hip as a kid, or in your 20s you were in a car accident and you broke your hip. Okay, it can happen because of abnormal biology. If you have abnormal blood flow, there's a condition called osteonecrosis in which the femoral head becomes very degenerative. It can happen because of overuse. Maybe you were a marathon runner and you just wore out the joint. That's most common. And then it can happen from genetics. A lot of our arthritic patients will say, oh, my brother had a hip replacement, or my dad had a hip replacement, or my grandmother had bad arthritis. So the end of each bone, again, is covered with cartilage, and then what happens over time due to any of those reasons that we mentioned before is bone-on-bone contact leads to soreness, stiffness, swelling, and pain. So the best analogy I've found is a door hinge. So this is a beautiful new building, everything looks great. They got all these nice door hinges, right? So the door hinges are shiny, they're well lubricated, they move completely, and they're pain-free. So over time, we take it for granted, but all the things that we do, we walk, we get in and out of a car, we sleep without problems, arthritis can make those harder. So over time, your door hinge looks like this. You got this rusty door hinge, okay? It creaks, it cracks, the door doesn't open all the way, and that's kind of what I'll tell people arthritis is like, and that's what happens to your joint. So when we talk about people with hip arthritis, we ask them, hey, do you ever limp? Do you have trouble doing simple tasks like putting on socks or shoes or doing housework? Does the pain limit your activity or lifestyle? Do you have pain in the thigh, okay, the groin or the butt? And this pain can even sometimes go down to the knee. So how do you treat hip arthritis? Treatment options are somewhat limited, but you can use ice or heat, okay, whatever works for you. And that's the big thing with arthritis. Treatment is kind of whatever works for you. So you try it, and if it helps, great. If it doesn't, you don't bother doing it again. Anti-inflammatories, I'm sure we all have Aleve, Tylenol, ibuprofen, whatever you want in your medicine cabinet, those can help. Steroid injections. Anybody over here have steroid injections? Somebody, there's got to be a couple. Yeah, okay. So those can certainly help in the hip joint, and they'll decrease inflammation to help you have less pain. It won't help your arthritis, but it'll hopefully have less pain. And then exercise and physical therapy, believe it or not, can help your joints, kind of like we've already talked about. When those things fail, hip replacement, I'm sure anybody here know anybody or have had a hip replacement? Pretty common procedure. We basically take the diseased bone and cartilage and replace it. Here's a picture of what it looks like. So there is the femur from before, and here is what the new one looks like. You have a stem that goes inside the femur, you have a ball on top of it, and a metal cup that goes into your pelvis. Pretty common procedure. Here's what an x-ray looks like. On your left here is an arthritic hip, on your right here is a replaced hip. The metal's white, and that's why it shows up that way the metal shows up white on x-ray. So hip replacement, very common procedure, very successful, and it basically just helps people to walk without pain. One thing that in orthopedics we've tried to do over the last 10 to 15 years is A, make the implants and the procedures last longer, and B, make the recovery shorter, right? Everything's got to be better and be faster these days, right? So, one thing that's come up is the anterior approach. And if anybody's ever seen a friend or had one themselves, most incisions for hip replacement are kind of on the side or go into the butt. You guys know what I'm talking about? Maybe a little. So, in the anterior approach, the incision's right on the front of the hip. And the reason you do it there is because what it does, it allows you to kind of go in between two muscles instead of cutting any muscles or tendon. And by doing that, we think that we can let you recover faster without pain because we haven't cut anything. So it's minimally invasive surgery that allows for a faster recovery. So, and the way I do it on a special table, which allows me to use an x-ray machine in surgery to make sure the components are placed correctly and hopefully also help make sure everything's stable and appropriate for after surgery. So it's actually not that new of a thing, done in France in the 1940s, and then for about the last 15 years in America, more and more surgeons have been adopting it, really because we're seeing patients having better outcomes. So the less trauma to the body hopefully allows for less pain and a faster rehab and fewer restrictions after surgery. So most patients will actually have the surgery, they'll walk the day of surgery, and they'll go home the morning after surgery. Wow. And they can even go home the same day if they want sometimes. Most people will come to my office anywhere between 2 and 4 weeks after surgery, usually just kind of holding a cane in their hand but not actually using it. And not on any narcotics and feeling pretty well. So sometimes the hard part is actually making sure they don't do too many activities too quick. So that's one of the newer things that's really, I think it's going to be a big advance in hip replacement moving forward. Hip replacement as a surgery, you know, it's one of the best procedures in all of medicine. When we talk about outcomes, there are patient-reported outcomes, meaning, okay, ma'am, you had a hip replacement, how do you feel? Then there's a couple of questions you'll answer on a survey. And then you also have doctor-reported outcomes. Dr. Saxena, you did their hip replacement. Oh, went great, everything's good. Sometimes my response and the patient's response isn't always the same. In hip replacement, it's almost like 96% the same with positive results there. So hip replacement's a really great surgery. So the leading cause of hip pain is arthritis. It's a degenerative condition that won't get better, might get worse. And early diagnosis and using kind of the non-operative treatment options is really key to kind of let you function and let you be happy. And hip replacement eventually, if you fail the non-operative treatment measures, can help relieve pain and improve mobility. So I was going to move on to the knee.